I'm Dr. Edward Scher with Premier Foot and Ankle Clinics, and today we are looking at a nasty ingrown toenail. We're going to perform a permanent nail removal, at which we use a device called the Matajet. And this Matajet is high pressure, cock action, and we put a little dot of lidocaine in the skin so when we perform the injection, you do not have to feel the needle. It goes like this. You can see the little white area where the lidocaine is actually present there. Place the needle into this area. You will not feel it go in. And hence, we can do a near pain-free injection in order to numb that toe. If I'm in a bad mood, I do not use the Matajet, and I will just put it in your toe. Keep me in a good mood. Now that the patient's numbed up, we do prep it with the betadine to help reduce risk of infection. This is what we call it, instead of a tourniquet, they call it a tourniquet. And it will help to keep any kind of bleeding down and keep it from diluting the chemical that kills the root. You just simply slide it down like this. Yeah, toe ring there. Make sure he's numb. And do you feel any pain? No? Great. Once the nail bed is loosened up, then we will cut it down the side, straight down to the nail matrix that's where the nail develops and grows, and we'll remove that portion of the nail and then kill the root. And that will keep it from coming back again. More often than not, the pain is not that bad afterwards, and usually this Tylenol or Motrin is enough for a patient to take. We do not advise you doing this at home on your own toes. And there's your nail coming out, the culprit of the pain. Sometimes we scrape in here to make sure there's no portion of the nail that may have broken off in there, and that's all cleared out good. We'll also make sure the root's out of there good, and it appears to be. So that's good. At this point, we're going to apply the chemical here. Use a little sodium hydroxide, which is kind of like an acid, and that will burn the root, keep it from coming back again. Ready. This little piggy's been defanged. Good. So this is what we use to kill the root. It's 10% sodium hydroxide. And with that said, we use vinegar to actually dilute that and neutralize it. Very good. We're going to put a little compression bandage on called Coban with a little bit of gauze and Neosporin. The patient then is given home directions at home how to take care of this, including soaking it daily, and we will give a home treatment kit up front before they even leave, so they don't even have to go to the store or anything. You have it all right there for them. Got this on here. Good. We like to leave the tourniquet on so it doesn't bleed while we're wrapping it, and it makes it a lot easier and less messy. The patient will leave this on the compression dressing for about 2 to 3 hours and then take it off because it can be very tight on the toe. We just don't want to cause any problems with the nerves or shutting down the circulation too long. So usually after 2 hours, they will remove this blue dressing and then they will apply the dressings that we dispense from the office to them at home. They will usually come back to the office in about 2 weeks just to make sure everything's healing well. We're not seeing any signs of infection, which can happen if the patients go barefoot and walk on the ground. All that dirt and dust is there, so they can quickly become infected. And then, at this point, we'll go underneath here and cut this tourniquet off. And voila, we're finished. So after a nail procedure, we also dispense Amerigel post-op surgical kit, and also this is from a company named Toslin, and it's a therapeutic foot soap. It's much better than Epsom salt because it has antibacterial, antifungal properties, which Epsom salt does not have. It also has a lot of properties that are good to keep your skin healthy, where Epsom salt will dry out the skin. They'll do this for about 4 to 6 weeks until the nail is completely healed once again. If we don't do it the full 6 weeks, many times a secondary infection can set in. So it's just better to keep doing it until it's there.